Well, good afternoon, Jay. We're just thrilled that you could be with us, even though we're having to do it by Zoom. Your vast knowledge and expertise in epidemiology makes you just a perfect person to talk about, what has transpired really over the last 4 years. And of course, our audience is going to be very, very interested in the Great Barrington Declaration. But let's back up a little bit because I really want you to talk about how you first got an inkling that things were going in the wrong direction with the epidemic.
Well, first of all, thank you for the opportunity to speak to you and to speak to the audience. I really wish I could have been there in person. So on the epidemic, in January of 2020, just like everybody else, I started seeing the reports of what was happening in China, and of course, I was quite concerned. I had been doing work. For 2 decades on infectious disease pandemics. I'd published a few, mostly just research work, though, nothing public. I'd never written an op-ed before in my life. I'd never been on TV in my life. But I remember what happened in 2009 during the swine flu pandemic. That was one of the first thoughts I had when I saw what was happening in China in January 2020. And I remembered that there were a whole bunch of studies that found that there were a lot of people that had antibodies that to the swine flu in 2009 that had never come to the attention of doctors. And the pandemic, in those early days of the pandemic in 2009, people were really scared about the high mortality rate. After that, those set of studies, people got much less scared because they understood the risks better, accurately assessed by antibody evidence. The antibody suggested that people had been infected and recovered, right? And so that was the first thought I had. Then as time went on and people started talking about lockdowns and I just grew horrified. And I mean, part of that was I've done a lot of work in my life and also have this background. I'm from India originally. And I know what it's like when when economic systems go south for the poor. And the idea of lockdowns horrified me because I could see coming what was going to happen, that every single poor person on the face of the earth was going to be harmed by the economic consequences of the lockdown. And so those were the true primary thoughts I had in the early days of the pandemic.
Well, how did it come to pass that you and Dr. Gupta and Dr. Kaldorf got together and thought you would write an open letter to the world, really?
Do you mind if I back up just a little bit? Because there's a little bit of history between that. That happened in October 2020. The summer really, it really shocked me about how our medical care systems and our public health systems, how poorly they operate and how they interact. So, I mean, this is something I've been in these fields for almost 2 decades as a researcher, and I confess I had a Pollyannish view of them. And spring and summer of 2020 disabused me of that. So what happened was that I wrote an op-ed in March of 2020, essentially laying out the hypothesis I just told you that in fact there were a lot of people very likely to have already had COVID, and we just didn't know about them. In April of 2020, I conducted a study in Santa Clara County and then another one in LA County that found exactly that in fact about 3% of Santa Clara County had already had COVID, 4% of LA County, and that for every person walking around that had gone to the doctor for COVID, there were 50 people walking around with antibodies that never went to the doctor. This is early in April 2020. What that meant, there's 3 lessons. One was that the obvious one, which is that 3%, this is the virus, this is the epidemic, has a long way to go. But then there were 2 less obvious ones that were really equally important. One, that public health wasn't picking up all of the people. The idea that the lockdowns and this contact tracing and all these other ideas were going to work so that we could get down to zero was a fantasy. And then 3, the risk profile of people dying. It was older people that were dying, younger people that were relatively spared. It's not that there were no young people dying, but for children, there was,
Right.
on the order of 1 in a million, 2 million, 3
Right.
million risk of dying. And so that suggested a strategy of focused protection, protect the vulnerable old with whatever tools are available, and let regular people just go about their lives. And this is April of 2020. By the way, this was not new to me. There were a number of other epidemiologists and scientists saying this strategy. It's the old pandemic strategy. It's what we've done for a century, and it works, right? You don't disrupt all of society because you're going to end up harming people's health and undermine confidence in people's in the public health systems. Um, my colleague and friend Scott Atlas, he got invited by the President of the United States in summer of 2020 to go advise him, and he and I had been talking continuously. And he went and told the president very sensible things: protect older people, don't open up the schools. Just very sensible. Normally, what we would do in a pandemic like this. Um, and I saw him and my colleagues absolutely demolish him. Like the Stanford faculty senate voted essentially. I mean, I don't have another word for it. They voted to excommunicate him. This is a man who'd
Right.
been the chair of neuroradiology for a decade. He'd been advisors to presidential candidates on health policy. I mean, you can disagree with his politics, or maybe you don't like how he talks, but in terms of his ideas, they were entirely reasonable. And had they been followed, it would have been a tremendous thing. He engaged us to go visit with President Trump. We sat with him. This is in August of 2020. I mean, I was hopeful, but then nothing seemed to come of that. As the summer wore on, September comes along, and the schools close. My kids can't go to school. I live in California. My kids didn't go. Actually, they didn't see the inside of a classroom for a year and a half. And I
Oh,
know I was looking at data from around the world. The UN was reporting that 130 million people were starving as a consequence of the economic dislocations caused by the lockdown. The World Bank was reporting 100 million people thrown into dire poverty by the economic. I mean, the entire policy was almost tailor-made to destroy the lives of the poor. And in this country, there was like food lines in Dallas around the block. There were like you have like, how do you, if you're a single mom and you have a child who's in first grade or whatever, and you have to choose between going to work and feeding your child and leaving him alone all day long to sit on Zoom to learn how to read. It was so obvious that it failed. The CDC had done this study where there like 1 in 4 young adults in June of 2020 had seriously considered suicide.
yes. Hmm.
And so I just felt like I had to do something, and the university was it was a really tough place to be because of the reaction to Scott. There was direct attacks on me also, and I just lost. I said, okay, I can do my science, or I can and I wanted to continue to do my science, but I felt an obligation to speak up and say, look, something is really wrong here, and that's what led to the declaration. That's what led to the October 4th declaration with Sunetra Gupta and Martin Kulldorff. Martin called me up, said, Jay, I'm organizing a little conference in Western Massachusetts. I said, can you come? And it was like a week to go. He's like, yes, I'll come. Of course I'll come. Anything Martin does, I'll do. Asked me to do, I'll do. And he said Sunetra was coming, and I was absolutely thrilled because she's one of my heroes. I mean, she's an amazing. She's a professor at Oxford University. Martin was a professor at Harvard University then, and among the very best epidemiologists and scientists in the world, I believe.
Well, it was a brilliant declaration, and it was translated into I don't know how many different languages and almost a million. My husband and I both signed it. The first time we read it, we were thrilled someone was stepping up. I'm wondering if you ever had a chance to say, when you said that Scott Atlas had gone and had spoken with the president, and that you all had, and that, quote, nothing seemed to come of it. It's interesting that Deborah Birx, who, along with Fauci, was one of the major, contributors to the medical information that got to the president, and she admitted in her book that she was dead set against Scott Atlas coming and speaking, and that she intercepted a lot of the memos that were to go to the governors that were memos from the president. And she was pushing more masking, more lockdowns, school closures, et cetera, in spite of the fact that the president was actually advocating opening things up, which I find very just startling. Like, I find it startling that in academia, especially when you say what happened to, Scott Atlas at Stanford, what do you think happens when people who are normally extremely intelligent and intellectual fall prey to an ideology to the point that they would do something like that?
I mean, it's very vicious, and it undermines the capacity to have reasoned discussion. And the consequences here were terrible policy that harmed every poor person on the face of the earth and did not protect us from COVID. Right. Still,
Mhm.
we nevertheless, despite these crazy policies, had 1 million people die or more of, with or from COVID. And the excess deaths, 3 or 4 years of excess of like all-cause excess deaths that are among the worst in the Western world. So when I actually read Deborah Birx's book, as well as Scott's book, and
Mhm.
what struck me is that the confidence that she had in her ideas was out of proportion to what the data were saying.
Right.
And the way that she acted, it was essentially insubordination. In
Yes.
it was she is an advisor to the president, not the president herself. She doesn't get to set the policy, and yet she did set the policy in many ways. And she worked to undermine Scott in the press, vilify him in extremely unfair ways, rather than having an honest, open discussion in front of the American people where you got both points of view. Like, okay, yeah, we think it's the worst thing since the Black Plague. We need to like lock down everything. And then Scott's point of view, which was let's protect older people, but let's not harm children.
Mm.
Um, you know, I think that conversation had it been impaneled in late spring, early summer 2020, would have gone the policy would have gone very, very different. But Deborah Birx and Tony Fauci used their power at the top, especially Fauci at the top of the federal bureaucracy on infectious disease science, essentially to destroy Scott and to make sure that argument never happened. They wanted to create an illusion of consensus in favor of lockdowns that didn't actually exist in the scientific community, but they were quite successful at it, Jane. They were very, very successful at it. And if you think from a scientist point of view, why would you stay silent? I mean, like you see the head of the NIAID on whose grants you depend for your career advancement saying one thing, you're not going to speak up against him, right?
Mhm.
And then you can see the example of people who do, like Scott or me or someone,
Right.
and it's just like, okay, why do I want that?
Right. Well, you don't want that. I've often thought, I wonder what the response would have been by the American public if they had published on mainstream media that the risk of death from COVID was an 1,800 difference between people who were 75 and over compared to people who were 50 and under. And this kind of brings up the whole censorship uh, topic here, because it appeared that there was a dogma, especially on mainstream media. And, people have done montages of the exact verbiage that was used over and over and over. Do you think we've learned anything from all of that?
Well, that was a whole nother and very closely related strategy used by people in the federal government to squash discussion, right?
Mhm.
And actually, I think it started in 2020, but then was essentially weaponized in the Biden administration in 2021. Um, so we wrote the declaration, as you said, Jane. Almost 1 million people signed it. Like people from around the world offered us the translations. 4 days after we wrote the declaration, there was an email from Francis Collins, the head of the NIH, Tony Fauci's boss, to Tony Fauci, calling me, Martin, and Sunetta fringe epidemiologists. And then, I mean, I actually I'm sort of embraced this as like someone sent me a friend of mine sent me a business card with the word fringe epidemiology,
That's
fringe
great.
epidemiology on it. But it's kind of silly, right? But what is it? It's essentially an attempt to avoid a discussion. Rather than talk about the substance of what we were saying, what they wanted to do was an ad hominem attack. And the very head of the NIH engaging in an ad hominem attack in order to avoid a discussion. I mean, it's absolutely, it should shock everybody, right? And part of the strategy because you had this organic outpouring from scientists, from epidemiologists, from doctors against the lockdown dogma. Tens of thousands of doctors signed the
Mhm.
declaration, just like as you did, Jane. Actually, many of them paid a price for it. Like they lost their jobs for doing it. Tens of thousands of doctors signed it. Epidemiologists signed it. It's translated around the world. Almost 1 million people. The central federal authorities on health, like Francis Collins and Tony Fauci, viewed this as a threat to their authority.
Mhm.
And they deployed means essentially to get it suppressed. Well, by like placing propaganda hit pieces on me and my colleagues in the press, claiming that we wanted to let the virus rip, and then B, by by putting pressure on social media companies to essentially censor our message, right? Organically, it had grown. Within a week of us putting up a Facebook page, for instance, Facebook canceled the page
Yeah.
without any explanation. They eventually brought it back up, but it was like, if you did a Google search, you'd see all the hit pieces on the front page, and then like on page 6 or whatever, depending on where you were in the world, you'd see the Great Barrington Declaration itself. You got this like propaganda smearing on Wikipedia. You just had this essentially this all-out propaganda attack, and censorship played a vital role in that,
Mhm.
an absolutely vital role in that. And it turns out it's not just on lockdowns, but on topic after topic after topic. Like, so for instance, where did COVID come from? Is it a natural origin virus or a lab leak? In 2020, if you said it was a lab leak,
Yes.
that there was actually a valid hypothesis, you were going to get suppressed on social media. And that was an intentional decision by our federal government to go tell social media companies, you should censor, stop this from spreading. The very top of the NIH, again, Francis Collins and Tony Fauci engaged in this sort of game where they're trying to say that it's a conspiracy theory to say it's a lab leak when it's not a conspiracy theory. In fact, it's an active hypothesis. And in 2021, the vaccine injured, the COVID vaccine injured became target number one of the censorship campaign. We have emails from a lawsuit that I've been involved with that showed emails from the White House itself to Facebook threatening Facebook with, essentially extinction, at least implied, that's the implication, unless they censored in groups of people talking about their vaccine injury. And as a I do research for a living, but like I have an MD. Like from that perspective, from a medical doctor perspective, I just can't imagine this. Like, you have people who are hurt, who want to talk to each other. They have essentially a support group, and now all of a sudden they're told that it's somehow outside the bounds of polite conversation just to talk amongst themselves. I mean, and it didn't matter if they were saying true things or false things. The White House was essentially telling the social media companies, censor them or else. They became enemy number one, and the American First Amendment was violated at scale in order to essentially maintain an illusion of consensus that the vaccine had no possibility of injuries to people. The vaccine was effective in stopping you from getting and spreading COVID. That immunity after COVID recovery was a lie. Essentially falsehood after falsehood, defended not by actual argument, but by backhanded means to make it seem as if those ideas were wrong by suppression on social media.
Well, and the people who control the narrative actually control like the attitudes then of the American public, because it was bizarre. Initially, this huge reaction to the COVID-19 virus, you could almost justify it from the standpoint of they thought initially it was a lab leak, although you couldn't talk about it. But I'm sure the people that were in government were worried that this was a lab leak because they knew they had been involved in this gain of function sort of activity in that particular lab as well. But then all of a sudden, you became a pariah if you would mention that it was a lab leak. And I remember Tony Fauci went to elaborate means to say, it came out of the wet markets and that was the origin. Everything was spun. I was thinking at first that they were trying to quash any discussion of rational epidemiology, so that people would be so frightened and their lives would be so miserable that when they roll out this experimental vaccine, that everybody would be lining up to get the vaccine. And I think pretty much that was borne out. But then when people became skeptical of the vaccine, then they had to mandate it. So maybe you could comment on what your opinion as an epidemiologist is about mandates and about public messaging if you're utilizing fear rather than, coherent arguments.
Yeah. So I mean, that's a great question. So on the lab leak, I mean, there was, I think, internal discussions. We know that from FOIA emails now, where Tony Fauci himself was told by prominent virologists that the lab leak was actually quite a likely scenario. If so, there was definitely a cover up of it. Just want to make an epidemiological point. If there was a lab leak, and let's say it occurred in October 2019 or something, somewhere around that date, um, that meant the disease was likely already seeded all over the world by March of 2020. And so the idea that the disease is gone and seeded everywhere, and somehow you're going to have a lockdown to get rid of it, it's not consistent, right? Like if it's seeded everywhere and it's spread by aerosols, we don't have a technology to stop it. The lockdowns, there's in Mumbai, there's a 70% seroprevalence in the slums of Mumbai by July 2020. There's no chance of going to zero. The horse is already out of the barn, even before we knew the door had opened. Um, on the vaccine, on the fear mongering, that I agree with you, Jane. It was a central part of the strategy, right? At first, I think to like gain compliance on the lockdowns, because the government was asking us to do something absolutely extraordinary. They were telling us to treat our neighbors and our loved ones as biohazards. I mean, that is an absolutely extraordinary thing to require of somebody. It's not natural for humans to do that. We are naturally supposed to live in community with one another, like to hug our children, like it's just like to be near our elderly parents as they age. I mean, those are part of being human. If you're lucky enough to have children, if you're lucky enough to have parents still alive, right? We're supposed to be with friends. Those are fundamental parts of being human. In order to get us to just overcome our natural instincts along those lines, fear mongering was absolutely essential. Like there's a lizard part of our brain that's like they essentially took over, which is instinctively afraid of infectious disease, that thinks of others with infectious disease as unclean others, and public health did absolutely everything it could to like essentially use that kind of messaging. It was explicit in some places. Like there was the UK government was advised by this group called SAGE that explicitly chose fear mongering as a strategy. Explicitly. And the US, the same thing, like the exaggeration of the infection fatality rate, all of that. And you mentioned the link to the vaccine. I do think that I don't know if it was conscious at first. I think at first it was just getting compliance and lockdowns. But as time wore on, it became clear that there was going to be a vaccine candidate, and then the vaccine trials were going well from the point of view of Pfizer and Moderna and so on. The thought I think entered a lot of people in public health head that like if we just keep people in fear over this excess fear outside of what the data show, we can save them. When the vaccine comes, we can save them.
Yes.
Epidemiologically, though, and this is so if you looked carefully, as I did on what the vaccine trials actually showed in 2020, there's a few key things. One is the trials didn't include a very large number of older people. 40,000 people, a lot of young people in the trial. So the group that would potentially benefit the most from the vaccine, which is older people in principle, that was the idea. They weren't represented particularly well in the trial. Second, they didn't check to see if the vaccine stopped you from getting and spreading COVID. That was not an endpoint in the trial. It was not a clinical endpoint of the trial. The clinical endpoint of the trial was prevention of symptomatic COVID and the third, it was only for 2 months. They only checked for 2 months. They excluded the first 2 weeks. So after the first 2 weeks after you were vaccinated, they excluded that. Actually, if you look carefully, it's likely that during the first 2 weeks, you're more likely to get COVID. It's only after the first 2 weeks that you started to get the protection against symptomatic infection. So it's from a public policy point of view, all of these things are very, very important, right? So first, if you don't only know that the vaccine prevents symptomatic infection for 2 months, but not necessarily for the first 2 weeks after you get the vaccine, then you should be advising people to be very careful, especially older people, to be very careful in the first 2 weeks after vaccination. Second, you have the absolute benefit for the young people from the vaccine was very small because the death rate was very small. And so you have to be very conscious that if there's any side effects at all for young people, you're essentially telling them to do something harmful on net in expectation. And third, and this is very important for your question about the mandates, the idea that the vaccine stops you from getting and spreading COVID, I don't think it's a sufficient condition to justify a mandate, but it is a necessary condition. If you don't have a vaccine that stops you from getting and spreading COVID, then you should not have a mandate, right? Because the idea is that if I'm vaccinated, I'm not going to spread COVID from others. That's an external benefit. My status protects other people. But if in
Mhm.
fact it doesn't, we don't know that it does, then essentially I'm spreading a lie, right? That's
Right.
you can be around vaccinated people and still have the risk of getting COVID, right? There's no reason and distinction between clean, vaccinated, unclean, unvaccinated, right? That makes no sense unless you can show that the vaccine actually stops you from getting and spreading COVID, right? Um,
Mhm.
and so again, as I said, it's a necessary condition. I think you need more than that to justify a mandate, but you need at least that to justify a mandate, and you didn't have that. That is protection against getting and spreading COVID.
No,
Um,
but you and I have both seen the montage of all of mainstream media, the talk show hosts, the comedians at night, the anchors with the same thing. They cast people that wanted risk versus benefit explained to them regarding the vaccine as the equivalent of criminals, really. And they all said the same thing, including Walensky, the head of the CDC. It will prevent you and it'll protect your loved ones. And they didn't know if either of those were true. And in fact, neither were true.
100% that's accurate. 100% accurate, Jane.
Yeah.
They did not know it's true. The randomized trials did not demonstrate them because they didn't check those as clinical endpoints in the trials. They
Well,
could have, but they didn't.
so where do you think that we're headed in terms of any sort of future trust in like the CDC or the NIH, our government bureaucracies, and actually the mainstream media in terms of any kind of advice or medical mandates? But I guess let's talk about the bureaucracies first.
I mean, I think the public trust in the CDC is as low as I've ever seen it. And the funny thing about that is that I mean, of course, they've earned the lack of trust by misreading the evidence, essentially promoting demonization of people based on medical decisions, preventing people from getting early treatment where there may have been idea like they not evaluating the early treatments early enough. Like we should have had good randomized trials on a whole bunch of things in 2020 that we didn't. Um, and so, I think public health institutions have earned the distrust of the American people. It's a partisan distrust, which is interesting, right? So it tends to be
Yes.
more Republicans, I guess, are more distrustful than Democrats. The thing about public health is that it's not politics, right? So you have if in politics, if you win 50 plus one, you're a great politician, right? In public health, 50 plus one is a failure, right? Your job is to gain the trust by being trustworthy of 95% or more of the people, and so it's a catastrophic public health failure. And I don't see any clean path to getting that back until public health starts to admit the catastrophic mistakes they made during the pandemic. Um, Medicine is a similar thing.
Yes.
I mean, I just saw a survey published in the Journal of the American Medical Association. I think this past month that only 40% of Americans trust their doctor. I mean, can you imagine this? It is a catastrophic failure. It was like it was before, like in one survey before, it was like 70%, which was still far too low, right? Why is that? What is it about? Like once upon a time, your doctor was one of your most trusted advisors. You give them sort of like like a lot of trust over your health. You give them trust over all kinds of things. Like it was a relationship between the doctor and the patient that was like deep and abiding, built on trust. And now 40%, only 40% of Americans trust their doctor. Um, the practice of medicine is in absolute crisis with that number.
I would agree 100%. I myself was shocked with an internal medicine physician that I wasn't, she wasn't my personal physician, but I had many mutual patients with her. And she was recommending booster after booster after booster with the vaccine. Well, the word got out really in major publications, the Wall Street Journal amongst them, that there were actual cash rewards for a certain percentage of practices that achieved 70% booster rate, for example, for the COVID vaccine. I think there's been enough revelations of the corporatization of medicine that people have begun to distrust any suggestion to a treatment or a medication. And like you say, the administration and the bureaucracies earned that distrust. I think honestly, we earned that distrust. The physicians who are willing to speak out, for example, about early treatment and to support the targeted protection, et cetera, even were turned in if you wrote a prescription for ivermectin. I've never in my entire professional life had a pharmacist refuse to fill a prescription that was an approved, safe drug. This last 4 years has been an absolute topsy-turvy experience in terms of trusted institutions and the sanctity of the doctor-patient relationship. It's not good, and I don't know how we're going to repair it, but I think it's crucial that we do, both for public health and for individual health care.
I entirely agree with that. I think we can't have a public health system that's not trusted. We can't have a medical care system that's not trusted. Both are vital to the health of the public. But unfortunately, that's where we are. I think those institutions desperately need repair. And then the question is, how do we do it? Like how do we get back to where we ought to be as a country in those as institutions as you know, as doctors and as public health professionals? How do we get back to that state? And I mean, this is like a first step, I would think. But like, first is you have to admit error. The leaders of these institutions, like I just saw apparently the ABIM just took away the board certification of Dr. Pierre Corey and Dr. Paul, right? Both very, very prominent doctors who were, I mean, like when you're frontline, I'm not a frontline, I'm a researcher, but like if you're a frontline doctor and you're seeing patients for a disease that no one's ever had before, you're going to try things. And they were trying things and finding some success. And instead of like evaluating with a randomized trial very rapidly to see if that holds up, instead they're demonized, excoriated, and as if they're like somehow monsters, even though they're prominent researchers and physicians on the front line treating thousands of COVID patients, right? And rather than taking them seriously, we demonize them. You mentioned the corporatization of medicine. That was actually a major way that the control of physician practice, right? So if you work for a large organization as a physician, and they say if you prescribe this drug, we're going to fire you, in effect.
Mm-hmm.
You're not going to prescribe the drug. There's no chance of you prescribing the drug, right? And then and in some places they sent around the board sent around, like in Canada, I know this happened. They sent around patients to entrap doctors that were known.
Yes.
And then in California they passed a law that actually said that if a doctor doesn't reinforce the CDC's sort of propaganda, they're going to lose their license. And actually that law was actually finally overturned by a judge who said it was unconstitutional because it interfered with free speech rights. But even more importantly, it interfered with the doctor-patient relationship. Like if you think your doctor represents the CDC and not you, why would you trust your doctor?
All right. Well, we have seen major examples of censorship, and I want you really to expound a little bit more about the importance of recognizing censorship and doing something about it.
So, we talked about already, so the censorship was pretty fundamental to how to create an illusion of consensus in favor of really, really bad policy. And it prevented an adequate pushback from lots and lots of people who knew better. And it was an intentional policy of the American government to censor these discussions. I've been involved with a lawsuit brought by the Missouri and Louisiana Attorney General's office called the Missouri versus Biden case.
Mm-hmm.
It's actually from this lawsuit, the discovery in this lawsuit, that we've seen. I've seen the direct evidence of pressure from social media, from the government entities, the White House, the CDC, sort of all these government entities, so the Surgeon General's office, forcing social media to censor people that they didn't agree with. And so it's kind of shocking to me that this happened. The lawsuit it was really interesting because the lower courts essentially were shocked by this discovery and issued a preliminary injunction telling the social media companies to stop, telling the government to stop censoring the social media companies. It's an extraordinary thing to get a preliminary injunction. But just based on the limited discovery we already had, it was absolutely, like the lower courts were saying things like, this is an Orwellian ministry of truth that the government has imposed, the Biden administration has imposed. When this case reached the Supreme Court, however, there was a 6-3 decision against the preliminary injunction. And what they said was that I and the other plaintiffs in the case lack standing to sue. And not, there was a direct attack by the federal government against the kinds of ideas I was spreading, saying I was blacklisted on Twitter the day I joined Twitter in 2021. It's very clear that the government wanted people like me off the no one to hear from me, right? And they use their leverage with social media companies to try to force that to happen. But the Supreme Court said there's no direct email saying from the White House to social media companies saying censor Jay. Instead, they have these like pressure to say censor the kinds of people that talk about the inefficacy of the vaccine from stopping from getting and spreading COVID, right? That's the kind of thing that they would have. And so if I say that there's such a thing as a natural immunity, I get censored. They essentially what the ruling then says is that that it's not okay to censor. They still admit that, but no one can sue unless they can prove that they are personally targeted. That means the government, in principle, in order to get around this First Amendment prohibition, can just say censor these ideas, and no one will have standing to sue. And you essentially you have an end around the First Amendment. And the First Amendment is a dead letter, right? It's an unenforceable dead letter. I mean, I think that is the danger we face right now. Where the case is coming back down to the lower court, I think we're going to get standing in the lower court because we've been joined by some other plaintiffs like RFK Jr., who very clearly were directly impacted. And I think also, in addition to the Supreme Court, the courts, essentially, I think we're going to ultimately win the case. But I also think that Congress should act to try to put in a law that says there should not ever be direct censorship control from federal bureaucracies through social media. The federal bureaucracy needs to respect the First Amendment.
Well, let's hope that's how everything ends up, because honestly, we can't sustain a republic form of democracy with an uneducated population, period.
100% agree with that.
Until there is an acknowledgement that mistakes were made, we're sitting ducks for the next time that a governor or the president wants to invoke the Emergency Powers Act. And then all of a sudden we have one person, either statewide or on the federal level, who's calling the shots, which sort of brings me to, I'm dying to ask you what your opinion is about the World Health Organization and their machinations regarding world control for the quote next pandemic.
So I think, so I should say again up front that I just like with medicine and public health, I think there is a role for a coordinating body like the World Health Organization when there are global pandemics. I'm not against that per se. I think it potentially could be very important, right? So to help if there's like some place that's hit really hard, to like make it so that that you can get resources to that place, sharing information. I think those are the kinds of roles the World Health Organization could productively play. The problem is that the World Health Organization does much, much more than that. And has taken on itself the kinds of powers that a supranational organization ought not have. You saw this with the fight over the recent pandemic treaty or the revisions of the international health regulations, right? The IHRs. Essentially what the World Health Organization would like to do, although they won't come out and say it, is that they would like to order every government on the face of the earth to go on emergency footing as soon as they declare an emergency, not permitting the local circumstances of the governments of the countries to like be taken into account effectively, right? What's happened is a lot of the poorer countries of the world have started to object to this. I'll tell you, like I just give you I could go on at length about this, but I just give you one idea around why this might be. When the Omicron variant hit, it was like like late December 2021, early January 2022. It was discovered in a South African lab. There was a very brave South African doctor who said, "Look, I found this variant. It looks like it's causing a milder disease than the previous variant," and like publicly announced it. As soon as she publicly announced it, the U.S. And now these public labs, these little labs, are set up around the world in part because of the World Health Organization, right? They're the ones that like induce the reporting, the sharing. She was just doing what the World Health Organization would encourage her to do, which is share this information. And actually, it's the right thing to do, right? Um, the U.S. responded by banning travel to and from South Africa. The UK responded with the same way. Essentially, South Africa was punished for especially for a disease that's already everywhere. It's not just it's not only endemic in South Africa. Like days after the South African announcement, it was Omicron was found in Italy, in the Netherlands, and the US and the UK. Everywhere is everywhere. And yet, for a while, you had South African tourism and the economy just absolutely crushed for the crime of discovering the Omicron variant. The World Health Organization, I think, it's overstretched itself. And on COVID origins, and lockdowns, it systematically drove the conversation around the world. In the early days of the pandemic, it pushed the idea that a lockdown could work because it was essentially doing the bidding of China. Like it sent a delegation to China. They came back saying the lockdowns in China in January 2020 worked, and pushed governments everywhere to take it more seriously, meaning do more lockdowns, essentially exporting the Chinese policy worldwide. The World Health Organization needs to, if it's going to succeed as an organization, needs to respect the sort of the ideals of the free world as much as it respects the ideals of China.
or the sovereignty of nations. I think it's an advisory role or an informational role, or as you've said, a rigorous discussion of what's going on around the world. Certainly it has a role, but I have concerns about national sovereignty just for the reasons you've mentioned. Is there anything else you want to share with us regarding where you think we are right now in terms of preparedness if we were to have another epidemic here? Do you think we've learned anything and we'll handle it differently, or are we in limbo? I mean, what's your assessment of our current situation should we get hit with another epidemic, which of course we will, but...
Yeah, I mean, in fact, there's H5N1 avian flu, which is floating around. We just declared a monkeypox epidemic, apparently. The World Health Organization did. So it's not hypothetical. These things will happen, right? The question is, what will we do about it? I think there's two conflicting ideas I have in my head. On the one hand, there's been an utter failure of institutional bodies to actually do an honest assessment of what happened during the pandemic. Like normally after plane crashes, you get the NTSB comes and does an examination of the black box, you get these reforms. None of that has really happened. We've had partisan fights in the US around the pandemic response. There's a UK inquiry, but no real honest, open discussion about pandemic failures leading to reforms. And so, and in fact, what quite the opposite has happened. Like what you've essentially is an institutionalization of the powers that allowed the governments of the world and public health to impose lockdowns and other extraordinary emergency measures. It'll be easier next time to do it, in part because of that. Not everywhere. Like I think some red states, for instance, pass laws to try to restrict the emergency powers, but by and large, around the world, it's easier. And so I think that in that sense, people should be very, very, if you would like to make sure that your kids' education doesn't get interrupted again, well, we're not in a place like that. We haven't decided we're going to protect kids' education as a priority in the case of a pandemic. Just haven't decided that. And until we do, the lockdowns could very formally easily happen. Could happen again. Let me to the other side, because I don't want to end with bad news. The other side is that we have a large fraction of the populace, 30, 40, 50%, I mean, probably much more, intuitively understand that something went really wrong, not just in the disease, but like in the response. And that part of the populace will not abide another lockdown. What will happen is then a massive political fight if there's a virus like COVID that's floating around, novel virus like floating around, where you'll see a lot more resistance than you saw this last time. But the tools that the institutions have to sort of gain compliance during COVID, the fear mongering and so on, they'll be in play in full force. And I don't know which will win. Whether a determined populace saying, look, yeah, I don't want to harm my kids for something that poses a very low risk to them, or this fear mongering, you must listen to, we must do what we say or else kind of thing. I don't know. It's really hard to see forecast forward for me. Those are two frames, I think, and they're going to compete with each other going forward.
Well, and unfortunately, you mentioned earlier that a lot of this has become politicized, and people associate leftist versus right with how you view measures that were taken. And I think it points up how leadership really does matter. If we were to have leadership that asks for accountability, where we washed out our dirty COVID laundry, if you will, and we demanded accountability, I think we might be setting the framework then for a more lucid and effective public health measures going forward when we have the next epidemic. Certainly, why we didn't hear from people like you on a wider scale, and why presidents and governors don't call in panels of private sector academics. I still call academics private sector to a certain extent, certainly not government bureaucrats, to put all the intelligent heads together and come up with something like the Great Barrington Declaration. When you've mentioned all of the pain, suffering, and economic loss around the world from mismanagement, certainly I would call that an overwhelming need for accountability. I don't know if we'll get it, but people like you are fighting for it. And I think we have a lot of people in AAPS also who are doing what we can in our own venue. And certainly you have a huge platform now. And we're so thankful that you use it and that you're willing to speak out. And I've really enjoyed going through your thought process as you went along. And hopefully people listening to this at our meeting and going to our website are going to have a lot of things clarified in their mind going forward. And I think it's going to have a great impact. So thank you so much for joining us, and all the best to you, and continue all your great work.
Thank you, Jane. It's so nice to talk with you, and thank you for the opportunity to reach your organization. I do think it's folks like you that are going to play a vital role in revitalizing medicine and public health, and I'm pleased to be able to play a small part.
Well, thank you. Onward and upward.
Yeah.